people coming through my door that I'm greeting can be from one extreme to another. You could have parents, they're expecting a baby, or you could have someone who has someone there in CCU. And I'm just glad I'm there to help in whatever the case is, to help the person.
As a labor and delivery nurse, whether my patient deliver and be healthy and have a healthy baby, or whether they be sick and deliver a sick baby that has to go down the hall to the NICU, I like to keep my patients, my family, and their baby connected.
Family physicians are here to connect patients to the healthcare system. And in a way, we're sort of the quarterbacks of their healthcare. We want to improve their access to healthcare and provide evidence-based care for their medical conditions, as well as quality and timely preventive healthcare services and screening.
Cancer can be a very challenging journey to go through as a patient. Here at SELF we have a variety of support services that help our patients figure those things out and help them get through this journey through their cancer treatment.
We're a medical teaching program where we take medical school graduates for 3 years and train them to be effective family physicians in the community. We have a total of 30 residents at our training program. That's 10 in each of 3 classes.
We have all the major specialties in this area. We regularly refer to the surgeons, the gastroenterologists. We have trauma surgeons, and we're a trauma center, and they're very important. They work with the orthopedic surgeons. We have a very active orthopedic group, the neurosurgeons here as well. We have a dedicated spine center for people with back and neck problems that the neurosurgeons play a part in. And we also have a pain center as well as a wound clinic.
Having all the tools to take care of cancer patients requires a variety of physicians and experts in cancer care. It also benefits the patient to have someone help them navigate through that process.
We can provide neonatal care to extremely small babies to the bigger babies if the babies have any problems. And majority of the babies who come to the neonatal ICU have breathing problem, and we provide mechanical ventilation for those babies and other support for the infants. And after stay in the neonatal intensive care unit, we discharge them to the pediatricians and the primary care providers outside of the hospital.
This is the SELF Regional Health Express. We use the Health Express in a variety of different ways. Our main purpose is to go out throughout the Lakelands and offer a variety of basic screenings. This includes Greenwood County, Lawrence County, Edgefield County, Abbeville County, McCormick County, and Saluda County as well. 2 of the basic screenings that we provide are blood pressure screenings and diabetes screenings. When we encounter a patient who does not have services such as a physician or insurance, we connect them with Access Health Lakelands, and they refer them to a physician with SELF Medical Group. Our community is very fortunate to have so many opportunities for our patients to be cared for. Certainly the first one that comes to mind is the ER. If you have no other place to go, we'll take care of you. But the Montgomery Center also takes care of patients and follow up for us that may be underinsured or have no insurance. The Carolina Community Health Centers take care of patients on an ability to pay, and they take many, many, many patients.
We began manufacturing our products here in the United States in 1979, and now we've expanded our employment to over 300 associates here on the Greenwood campus. Because Velux is a self-insured insurance plan, we decided that we wanted to do what we could to control our cost as a company, but also provide the best health services for our employees. Through the years, we'd made multiple plan design changes to our insurance plan to help control the cost. And eventually it became obvious to us that improving our employee health was the one sure way to reduce our costs as an employer. And so that's when we started to think about adding an on-site clinic. And we began that process of looking for a vendor and looking for possibilities, and we were approached by Self Regional, and that was a wonderful partnership for us.
The majority of what we see out here is acute illness and injuries, things like sore throats, coughs, rashes, fractures. We also see some chronic illness. We generally catch that early before the patient is aware that they have the chronic illness.
After I got hired full-time for Velux, I found out they had the wellness program. And I had been neglecting some of my health issues. I had high blood pressure. So after I got hired and got into the program, the nurses worked with me. They were very patient and very knowledgeable about their job. They got me back on track, got my blood pressure regulated.
My first orthopedic experience was my right hip replacement. Then I had the left knee replaced, and then I had the right knee replaced, and then I had an automobile accident which broke a bone in one foot and shattered the other ankle. After each surgery, when I was released from the hospital, I went to Greenwood Rehabilitation Center for the knee and the hip. I stayed there about 10 days, and then after leaving the rehab center where they have you in physical activity 2 times a day, I went home, and then Salento, my trainer, came to my house and brought bands and balls and things that we could do before I was able to drive and come back to Wellness Works. And I am 82 years old, and I started this process at 73. I did it, and I know everybody else could do it. You just have to work at it.
One day I found myself as a preterm sick patient in the bed, and I was no longer the nurse, I was the patient. I abrupted, which is where my placenta detached, and it became a life-threatening emergency. I would love to have been a fly on the wall in that OR. My director was there, my manager was there, multiple nurses were there. She was born at 32 weeks. I'm glad to say that she is now 15 months old. Spunky. You would not be able to look at her and tell that she was only 3 pounds when she was born. She is a healthy, full of life child.
Not only do patients benefit from having expert medical care, but sometimes just having a friend who has also gone through a similar journey to talk to is important.
There was one day when my husband came to pick me up from work. I knew immediately that something was wrong. He told me, he said, "Honey, I don't feel right." And when I looked at him, I knew something was wrong.
Immediately when she saw me, I said, "Honey, I think I'm having strokes." She got in the vehicle with me, got me to the hospital, and they rushed me upstairs.
Walking through the doors of Self Regional that morning, through the ER, I was so scared. And the staff they treated me, you know, it does mean a lot when you walk in, someone is smiling at you, willing to help you. It just made all the difference in the world because I was so afraid. They immediately started working on him. Dr. Cook and the emergency room staff and Dr. Cook administered the TPA shot, and I thank God so much for that because that is what worked.
I was just afraid. I was very afraid because I knew I was having strokes. And when you're having strokes, the first thing you think about is what are the long-term effects going to be? So I was afraid that my right side wouldn't be working anymore. So I was already giving consideration to how I was going to live, what my lifestyle was going to be about. All that was running through my mind at the same time. Just wondering what my life was going to be about after that day. One of the main things that was going through my mind was, would I be able to still play my guitar? As a matter of fact, it was one of the first and foremost things I was thinking about. Would I be able to play again? It's my living, it's my life, it's what I've always done. It's what I guess I'm better at than anything else, so that's what was on my mind. Could I still play my guitar? I stood by my pickup truck with my guitar, and I'm about to cry now, but I cried like a baby because I thought about, I didn't even know if I was supposed to be there.
It's truly a miracle because they admitted my husband on a Monday. He was discharged on a Wednesday, and he went and performed on a Saturday night. It's truly a miracle. And again, I thank God and I thank Self Regional Health Care for saving my husband, because I love him so much.
Our hearts,
hands,
and minds
are leading our communities
to better health.
Health care
Connected.